Thanks, Troy. So my name is Alice Domes.
And my name's Jenny Spring.
Hmm. We work um, we work with the Center for Collaboration, Motivation, and Innovation, which is a nonprofit founded in BC with the mission of fostering empowered partnerships, building helping skills, and creating responsive systems that improve health and well-being. So today's webinar is about motivational interviewing. This webinar is made possible with the support of Patients as Partners, an initiative of the Ministry of Health in the province of British Columbia. Before we get started, Troy will review some features of GoToWebinar.
Okay, so if you've been to these webinars before, I'm sure you're getting extremely tired of my voice and this little spiel, but I'll go through it once more time, just for people who are new to the call today to kind of orient you with the operations of GoToWebinar. So what you're looking at, this slide right here shows what your screen is supposed to look like. You should have a little webinar being presented on the left, and then on the right you'll have the GoToWebinar control panel. The GoToWebinar control panel has a number of features which you can use. Alice, if you could go to the next slide. Back one, there we go. And the first one that you'll be able to use is the open and close of the control panel. So you can expand and collapse the control panel using this orange arrow at the top. And more or less, that's just going to allow you to view the webinar in full, or if you want to use the control panel, expand that out, and there are some features that you can use today. The one feature that we're going to use, if you go, yeah, there we go. The one feature that we will ask you to use today is the question box. If you have a question of a technical nature, if you're not quite hearing us or seeing us properly, you can ask a question in there, and I'll be watching that to help you out. Also, if you have a question that pertains to the webinar at hand, go ahead and pop that question into the question box, and Jenny and Alice will field those at the very end. So we do really appreciate any question that you guys have. It really does allow these webinars to be a little bit more interactive, and it's a great way to kind of keep the conversation going. So I think that's it from my side, and I'll hand it back to you guys.
Okay, thanks, Troy. So our goal today is to give you a brief introduction to motivational interviewing and how MI can be used to support patient-centered care, stepped care self-management support, and how MI aligns with the Ministry of Health's aims and priorities. So before we introduce MI, or motivational interviewing, we want to review the Ministry of Health strategic priorities and aims. The Ministry of Health priorities are, first of all, to improve access to primary care through a primary care home model, reduce demand on hospitals by improving care for seniors, reduce demand on hospitals by improving care for those with mental illness and substance abuse issues, improve access to surgical services and procedures, and fifthly, improve delivery of rural health services. The Ministry of Health has adopted the Institute for Healthcare's Improvements triple aim with these three goals. First of all, a better experience of care for both professionals and people receiving services, better population health, and better health at a sustainable cost. When MI is incorporated into practice, it can produce benefits for all three of the triple aim goals. In the policy document, A Patient-Centered Care Framework, the Ministry states that patient-centered care puts patients at the forefront of their health and care, ensures they retain control over their own decisions and choices, helps them make informed decisions, and supports a partnership between individuals, families, and healthcare service providers. It includes self-management support, shared and informed decision-making, an enhanced experience of care, improved information and understanding, and advancement of prevention and health promotion activities. Patient and family-centered care contributes to the goals of the triple aim. Many aspects of self-management support are part of patient-centered care. Motivational interviewing is grounded in compassion, acceptance, partnership, and evocation of a person's own ideas, wishes, and desires for change around their health. This directly reflects the patient-centered care framework.
A vital component of meeting the Ministry of Health's aims and priorities and the patient-centered care framework is supporting people using appropriate approaches at the level of care that they need. As discussed in previous webinars, self-management support can be stepped up to meet people's needs. Today's webinar addresses motivational interviewing, which is on the third step. Motivational interviewing, MI, a more advanced approach, addresses the common situation of ambivalence, or feeling two ways about something. All of the prior steps in the stepped care self-management support model, including health literacy, engagement, problem solving, and goal setting, continue to be used to help meet the person's care needs. What is motivational interviewing, or MI? Motivational interviewing is a collaborative conversation style to strengthen a person's own motivation and commitment to change. And that is taken from Milner and Rolnick, Motivational Interviewing, Helping People Change, the third edition, published in 2012. Ambivalence is normal. One of the things that strongly influenced the development of motivational interviewing is that ambivalence is common and ambivalence is normal. We want to change and we don't want to change, like this child that can't decide what to do next. It's normal to feel two ways about something. MI was designed to help people who are ambivalent find their own motivations to start making changes. People who are ready for change don't need motivational interviewing. Sometimes they can change on their own, or sometimes they need little help, like brief action planning. People who you will help with motivational interviewing need a bit more time to sort through their ambivalence until they're ready to make a plan. The more ambivalent they are, the longer this may take. It may be several conversations before there is a plan. Another way to think about motivational interviewing is to think about dancing versus wrestling. Motivational interviewing is like dancing with someone. You're moving together, working together to make something beautiful. Someone is guiding the partner in the dance without tripping or stepping on toes, similar to the art of motivational interviewing. The other option is to wrestle with them, moving against them, pushing them around. Even if you do get them wrestled into what you want them to do, they are down, and now you will have to help them get back up and stand on their own feet. How likely is it for someone who has lost the wrestling match to feel motivated for change? Patients or clients who may not follow through with a plan may be called non-compliant. This relationship is frustrating for both the healthcare provider and the client or patient. Calling someone non-compliant is neither consistent with the spirit of motivational interviewing or what we know about helping people change. Motivational interviewing is a very person-centered approach. There is a range of styles that you can use when interacting with people, and none of these are wrong. On the left side of the range, we have a more directive style, where the guide or helper is providing information, instruction, and advice. This can be a very important and necessary part of practice. When we're teaching another or when we have to lead in an emergency, it's appropriate to direct when someone's safety is at stake, or they've asked us to. On the far right, we have a non-directive style of following the person. The helper refrains from inserting their own ideas unless requested. This includes listening or just being with someone after a stressful situation or when they are coping with a difficult dilemma in which there is no right or wrong way to decide. An example might be someone who is trying to decide to be a living kidney donor, or a couple is deciding whether or not to have children. In the middle is a guiding style, and this is what MI is about. Motivational interviewing, or MI, has a direction, but it is not directive. It is based on the person's goals. It follows the person as they work through dilemmas, but with the person's goal in mind. If you've ever been on a tour with a really good guide, they will find out what your interests are and guide you in seeing what you wanted to see. If danger appeared, they would direct you and protect you. This is what MI is about.
Now we will move into talking about the foundations of motivational interviewing. These include the spirit of MI, the 4 processes, ORs, and change talk. Let's first look at the spirit of motivational interviewing, as described by Miller and Rolick, the founders and researchers who established this approach. There are 4 things that make up the spirit of MI: compassion, acceptance, partnership, and evocation. The acronym CAPE, or CAPE, is a memory device. CAPEs can be a sign of respect, protect us from the elements, and give us a sense of power, as we know from watching children transform into superheroes. So when we use the spirit of MI, we are protecting the person, creating a space for them to work on change, and bringing out their own powers. The spirit of MI is the foundation for motivational interviewing and is congruent with the patient-centered care, improves patient and provider satisfaction, and ultimately leads to better health outcomes. It has been shown in studies that when clinicians demonstrate the spirit of MI in their interactions, the people they are working with are more likely to change. So the first component is compassion. Compassion is caring about what is good for another person and letting it become important to you too. The interaction is done with the heart. Receiving compassionate care is linked to greater satisfaction with care. Miller and Rolick have defined it in this way: to be compassionate is to actively promote the other's welfare, to give priority to the other's needs. Acceptance means you respect the other person in their right to change or not to change. It does not mean you have to agree with the person's behavior or beliefs. People who are competent have the right to make choices. Sometimes we may find these choices puzzling, but it's not our place to decide what is right for another person. We can help people make choices that better fit their goals, not our goals. Sometimes as clinicians, we do work with people whose competence to make decisions is compromised. We're not talking about that situation here, but respecting their autonomy as much as possible is still important. Miller and Rolick defined acceptance in this way: to honor each person's absolute worth is the first part of it, which is prizing the inherent worth and potential of every human being. Secondly, to recognize and support the person's irrevocable autonomy, honoring and respecting each person's right and capacity for self-direction to choose his or her own way. To provide accurate empathy is another component, which is an active interest in and effort to understand the other's internal perspective, to see the world through his or her eyes. And lastly, to affirm the person's strengths and efforts. Empathy is considered a part of acceptance in MI, and it was found that physician empathy ratings predict average blood sugar control of their patients, and this is a study in 2011 by Hoja. Now, partnership is working together with another person and recognizing them as an equal. We avoid the expert role as clinician, recognizing people have expertise about themselves. MI is not done to or on someone, even if it is done with the best of intentions. It is done with a person. In the Heisler study in 2002 of people with diabetes, the researchers found that patients are more likely to change behavior when they participated in the decision about the behavior. Lastly, evocation. Evocation means bringing out another's strengths and knowledge about the situation and themselves. People already have within them much of what is needed, and our task is to evoke or call it forward. The ideas come from the person, and our job is to help draw them out. Adults mostly don't like being told what to do in their personal lives. Most people's initial reaction to being told what to do is to put up resistance. Miller and Rolick define it in this way: The spirit of MI starts from a very different strengths-focused premise that people already have within them much of what is needed, and your task is to evoke it, to call it forth. The implicit message is, you have what you need, and together we will find it. Studies in alcohol treatment have shown that clients working with counselors who are directive talk less about change and are more resistant to change.
We would like to introduce you to a person to help us demonstrate how motivational interviewing might be useful. Mr. John George is a 62-year-old man who recently had a mild stroke. He has had high blood pressure for years, and although he was prescribed medication, he rarely took it. Both of his parents had heart disease, and his mother died after a massive stroke when she was 65. Mr. George is married and has teenage grandchildren. He is a retired forestry worker and has gained weight due to a decrease in physical activity. He smoked 1.5 packs of cigarettes per day prior to his stroke, but did not smoke during his hospitalization. He started smoking again after he got home, but is trying to cut back. The only deficit after his stroke is a slight weakness in his right leg and hand, and he notes he has had some increased difficulty finding words. He has physical therapy and speech therapy appointments, but they are an hour's drive away, and he's not very sure he will go. During the first visit since his hospitalization, Mr. George seems a bit withdrawn. The last time he was seen by his primary care provider was over 9 months ago. Mr. George doesn't like going to the doctor because it reminds him of taking his parents to the doctor when their health was failing, and since he hadn't been taking his blood pressure medication, he is afraid to be confronted about it. Mr. George used to hunt and fish and liked providing food for his family. He always thought he would get back to doing that after he retired, but it was too easy to stay home and watch TV. Mr. George participates in activities in his community and has always said he would teach his grandchildren how to hunt and fish, but he hasn't gotten around to it yet. We've talked about the spirit of MI, which is the foundation for any interaction. Now let's look at the processes of an MI interaction. In many ways, motivational interviewing is similar to many interactions that we have on a daily basis. When we think about how we might work with Mr. George, we can think about the 4 processes that will be important in our work with him. Dr. Bill Miller thinks about it this way. Shall we walk together? This is also called engaging. We want Mr. George to feel cared about, accepted, and collaborated with. Where? Also called focusing. Mr. George has a lot of things going on with his health, and it will be important to find out which things are most concerning for him and what he might like to work on first. Why? This is also called evoking. We want to help Mr. George evoke all the reasons why he would want to make a change. This will help him move from ambivalence into action about something that may be related to some of the medical issues we already know about, or something else entirely. How? Also called planning. We want to help Mr. George make a plan that is based on his experience about himself and what will work. Here's another way to think about the 4 processes, and we'll go through each part in more detail. Engaging. The process of building and supporting a relationship where trust and respect go both ways. Sometimes the reason that no change is happening is that the person isn't engaged in their health, isn't engaged in the visit, or isn't engaged in the relationship with you, the helper. Engagement isn't just the first part of the interaction when you establish rapport and trust. Engagement happens throughout the visit or relationship, as represented by the circle. When we introduce ourselves and establish rapport with another, we are engaging them in the interaction or the relationship. It's about learning about the other person, their situation, what matters to them, so that you can connect on a fundamental level. For example, we know that Mr. George values his family and community relationships and wants to pass on his knowledge and skills. Focusing. The ongoing process of choosing and keeping a specific direction. When we talk about the purpose of the conversation, We are focusing. In motivational interviewing, it is necessary for the conversation to eventually focus on one thing, typically a behavior, like quitting smoking, getting more sleep, or starting to exercise. We know that Mr. George is trying to cut down on his smoking, but there may be other issues that he wants to work on, like taking his medication regularly, or getting out into the woods with his grandchildren, or something else that he has not yet talked about. Evoking. Bringing another's strengths and knowledge about the situation and themselves. When we talk more about the topic that is the focus of the conversation, we are evoking the other's thoughts and ideas. Another way to think of this is encouraging to explore. We might ask Mr. George about some of the successes and changes he has made in the past. We might find out more about his reasons to want to make a change, being around to teach his grandchildren how to hunt and fish. And planning. The definition of planning is being with someone while they form specific actions to take. Mr. George may decide to move forward with changing his smoking behavior or any of the other things that concern him, or he may just make a plan to meet with us again. These are the 4 processes of motivational interviewing. There are ways we can talk with people that increase the chance they will be successful with the changes they want to make. Remember, not all conversations end in a concrete plan. These processes are displayed as circles within circles because in every interaction or relationship, we go back and forth between engaging, focusing, evoking, and planning. They are circular processes being monitored, revisited, and revised as needed.
We have talked about the processes of motivational interviewing, and now we want to talk about the foundational skills we use in an MI conversation through all of the processes. These skills include using ORs, which are open-ended questions, affirmations, reflections that can be either simple or complex, and summaries. Just like the CAPE acronym, you can use the memory device of ORs to remember these skills. Open-ended questions are questions that can't be answered with a yes or no. They invite the other person to do the talking. Examples include, what brings you here today? Or, tell me more about. So we might ask Mr. George to tell us more about his community involvement or his skills and experience with hunting and fishing. Affirmations communicate that you recognize the strengths in the other person. With Mr. George, we might affirm by saying, you know, you're really working on changing your smoking patterns. You want to provide for your family. It brings up sad memories about your parents when you come to the office, and yet you come to get support for your health, even though it was hard to do. Now we get to the reflections. Reflections are the way we try and understand the person we are working with. They may be the most fundamental skill of motivational interviewing. With humility, we explore what we think they are meaning by what they are saying. Simple reflections are just that. We repeat or rephrase what we heard. With Mr. George, we might say, you have 5 grandchildren. But if that's all we do, and we do it a lot, people may feel frustrated, or it may feel false. So an option is to use complex reflections. A complex reflection adds meaning or emphasis to what the person has said, making a guess on the unspoken content. More complex reflections tend to move the conversation forward. When Mr. George says that he has 5 grandchildren, we might say, you have 5 grandchildren, and being there for them is very important to you. If Mr. George talks about his smoking and says, I'm having a hard time quitting smoking, we might respond in these different ways. You're having a hard time quitting smoking and you're worried about your health. You're having a hard time with your smoking and you're not sure how to find your way through this patch of the woods. On the other hand, you really don't want to quit smoking, but on the other hand, you know that smoking is bad for your health. Now, summaries are a way to gather up what someone has said and present it back to them, kind of like a bouquet. It's impossible and not desirable to summarize everything the person says. You get to choose what is in the bouquet, and that's the art of a summary. And when you give it back, you are saying this is a bouquet you grew in your own garden. Summaries are used in many ways in motivational interviewing. Early in a conversation, during engagement, a summary can simply be a way of reflecting your understanding. It can be used to move the conversation forward during focusing, or to evoke talk about change later in a conversation. So in a way, a summary is an extended reflection, and it may include affirmations, and often ends with an open-ended question, so it combines all of the oars in one helpful package. After a conversation with Mr. George, we might say, we've talked about a lot of things today, your health issues, your family, and community, your love of being in the woods. What would you like to focus on in our work together?
With our MI spirit and understanding of the processes and oars, our goal is to converse with people in a way that helps them become less ambivalent and increases something called change talk. Helpers can learn to evoke or cultivate change talk, and then people respond with more change talk. More change talk is the thing that is linked to better outcomes. Change talk is any speech from the other person in favor of making the change. There's a flip side, of course, the other side of the coin, and they are inseparable like a coin, is sustained talk. Any speech from the other person that favors the status quo is sustained talk. The presence of sustained talk in excess of change talk predicts a lack of success in making a change. Remember, ambivalence is normal. It's normal to feel two ways about something. Here's an example. I want to spend more time with my grandchildren, but sometimes it's hard to find the energy. In motivational interviewing, we are listening for the side that favors change and helping people hear it to build their own motivation for change. Oars are used to evoke or cultivate change talk and to soften or decrease attention to sustained talk. When we hear Mr. George say things like, I have to be around to show my grandchildren how to hunt and fish, or I don't want to end up like my parents, that is change talk. As our MI skills progress, we can learn to respond to this change talk in ways that increases or evokes more change talk. When we hear Mr. George say things like, I just don't have the energy, or my TV chair is so comfortable, that is sustained talk. As our motivational interviewing skills progress, we can learn to pay less attention to sustained talk and help evoke more change talk. Listening for and recognizing change talk and learning how to encourage or evoke more change talk is a skill that can be developed with practice. Once our clients are energized about change, they are ready to move forward into making a plan, which is the last of the 4 processes. People are the experts about themselves, and any plan they make for change is more likely to succeed than any plan we might think up for them. Lundell and his colleagues wanted to answer the question, does motivational interviewing hold potential as an option alongside or within the delivery of routine medical care? They searched the literature for studies of motivational interviewing in healthcare settings and came up with 48 randomized controlled trials, including over 9,000 participants, 9,618 to be exact. The studies covered a wide range of outcomes, and the clinicians came from many different professional backgrounds. They included physicians, nurses, behavioral health providers, and health coaches. Many different types of people were involved in the studies. They included patients from both rural and urban locations, from different educational levels, and different ethnic and socioeconomic backgrounds. Their analysis of the studies showed that success is possible in interventions as short as 15 minutes. Many interventions were of longer duration, but that doesn't have to be the case. Study duration varied, and the longest studies followed the patients for a year, and they were still finding positive effects at 1 year. The authors concluded that motivational interviewing has a modest advantage over usual care. The meta-analysis of motivational interviewing in medical settings. This is a quote from the study. No matter what your professional training or where you work, if you can devote a small amount of extra time with your patients to build relationship and evoke change talk, you can expect a 10 to 15% additional improvement across a wide variety of behaviors and medical outcomes. There are several things known about what does and does not work in motivational interviewing. Some of it is described by the developers Drs. Bill Miller and Steve Rolnick in the most recent edition of the Motivational Interviewing book. New research continues to add to what we know about motivational interviewing. There are over 200 studies about motivational interviewing. Better outcomes are associated with three things. The first is the spirit of motivational interviewing. It is its underlying helping attitude. The second is softening sustained talk. This means that you always focus on maintaining engagement or the relationship while simultaneously focusing more on the desired change instead of the barriers to change. The third is called cultivating change talk. When people are talking about change, the best thing to do is build up hope and help them think about the future and next steps. There are negative trials of motivational interviewing studies, trials that showed no improvement. What was going on there? If you review those studies carefully, a few things are clear. In some studies, there is no way to tell if the clinicians were actually using motivational interviewing. The authors don't report any monitoring of what the clinicians actually did during the study, or there were no attempts to see how skilled the clinicians were. These studies may not have worked because motivational interviewing was actually not happening. It's hard to say. There are a couple of studies where it is known that the clinicians were using motivational interviewing, but it didn't work. What seems to have happened was that motivational interviewing had been put into a manual so strictly that the clinicians had to go through every step of a scripted approach. In some cases, the people were ready to change, but the helpers were required to talk about barriers. This was found to actually decrease the chance of the person changing. The conclusion from these studies is that motivational interviewing needs to be a flexible approach so that the clinician can respond to where the person is at and build naturally from the conversation. Since 1990, the number of scientific publications on motivational interviewing has been doubling every 3 years. There are currently more than 1,200 publications, including more than 250 randomized clinical trials reflecting a wide array of problems, professions, practice settings, and nations.
So in the stepped care self-management support model, MI is an advanced approach for helping people address their ambivalence about change. Motivational interviewing includes the spirit, 4 processes, ORs, and cultivating change talk. MI, or motivational interviewing, is the skill set that can be learned and developed with practice. There are some resources if you wish to pursue motivational interviewing further. One of them is CCMI, the Center for Collaboration, Motivation, Innovation. There is a community of practice, the BC Community of MI Practice. And then there's the Miller and Rolnick book, Motivational Interviewing, Helping People Change, third edition in 2012. And then there's the website, www.selfmanagementbc.ca/motivational interviewing. Now with that, we'd like to open it up to any questions that anybody may have. Okay. So does it look like there's any questions?
There's one that's come through.
Okay, I
The
don't
question
see it.
is, any suggestions on how to practice?
Any suggestion? Jenny, do you want to tackle this?
Well, I know that in my workplace, when I was interested in learning about motivation, there is an exercise practice book, and it's off the top of my head. I can't remember. Do you remember the person's name, Alice? The green book.
Yeah, let me just get it.
Sure, you get that.
Talking.
And what I did was I set up a little bit of a lunch and learn with anyone in my office area who was interested, who had been exposed to some of the motivational interviewing training. And we basically picked an exercise out of the book. Once a month we would meet and pick an exercise out of the book and just practice together. So that was one way that we just kind of, on our own, tried to practice. And we had a little bit of training in motivational interviewing already. It wasn't the best scenario in that there wasn't someone there to coach us, but that was certainly a way to begin to really think about how to bring it into our own kind of words and our own way of conversing with people. I'm not sure if that's possible where you are, but certainly that's one way. Do you?
Yeah, I have the name of the book, and it's by David Rosengren, and it's called Building Motivational Interviewing Skills, a Practitioner Workbook.
Yeah, that's the one. I'm not sure about other ways other than, you know, if there are opportunities for you to sign up for some motivational interviewing courses through your health authority, through CCMI. I'm not sure exactly what's being offered in your area, but I know that there is a rollout of some training in motivational interviewing, and certainly, you know, a good training program is one where there is a lot of opportunity to practice and build skills in the training. Did you have anything else to add, Alice?
No, I think you pretty much covered it.
Are there any other questions?
Nothing coming through right now.
Okay, should we
Yeah.
move forward? So we'd really like to encourage you to learn more about motivational interviewing. Certainly the book by Miller and Rolnick is a wonderful book and well written, easy to follow, so I highly recommend that. And the skills that we've talked about in this webinar are like any other skill, and they require practice and feedback. So that's certainly something about developing any new skill. And we encourage you to learn more about it by contacting your patients as partners lead in your health authority, or contacting the Ministry of Health, or by contacting CCMI. And the next webinar in this series is on October 19th, 2016 from 12 to 1 p.m. and it is Self-Management Support and Population Management, and being presented by Mike Hindmarsh, who works with us at CCMI. And you'll receive a survey after this webinar, and we hope that you'll participate in order to help us understand what we're doing well and what we could improve at CCMI. We'd like to thank you very much for attending this webinar.
Just one last thing, a comment came through that book is available for download in PDF as well. So if you want to go ahead, Google the book, and you can find it and download it.
Wonderful.
Which book is that,
The
Troy?
book that was mentioned, the green
The
book.
exercise
That I
book.
mentioned?
Mm-hmm.
Oh, okay. Good.
And with that, thanks all for joining.
Thank you.
Thank you.
Bye, everyone.